Hello, Dr. Day here from Steinway Family Dental Center. Today, we're going to discuss dental implants because we get a lot of questions about dental implants, and today I'm going to answer some of the most common questions about dental implants. The first question is, what are dental implants? Dental implants are basically screws that are replacing the roots of the teeth that we don't have anymore. So it is designed to replace missing teeth. And if we don't have the tooth or the root of the tooth, then we would place an implant and then put a crown on top of that, and that will replace the whole tooth. The next question is, what condition will make the dentist recommend dental implants? And of course, when you're missing teeth, the dentist will recommend dental implants. The next question is, what are the advantages of dental implants? The advantages of dental implants is that you can replace missing teeth without destroying the adjacent teeth or touching them, which means you don't have to drill your adjacent teeth to put implant in and replace the tooth that is missing. What is the process that I would have to go through if I need dental implants? Well, number one, you're going to need a consultation with the surgeon that's going to place the implants, and you would need a three-dimensional X-ray of the area to see where exactly the underlying bone is. That will make the surgeon decide the size and diameter of the implant that is best for the treatment for this particular area. That's how you do it. The next question is, what are the steps in placing a dental implant? Well, the first step, like I said before, is just to meet with the oral surgeon and get a consultation. You would get a three-dimensional X-ray for that so they can see exactly where the bone is. And then you would schedule the procedure with the surgeon. The surgeon then will give you anesthetic. It is a local anesthetic. There is no need for general anesthesia for this procedure. And the procedure is not ambulatory. It's not done in the hospital. It's not in the dental office. It's actually a very easy procedure. And if you had tooth extracted and you had bad experience with that, don't be deterred by that or from your dental implant placement, because it is much easier procedure than extraction. And it's less painful, you recover from it faster. It's really easy nowadays to place the implant and replace the missing teeth. So that would be the step to place the implant. And then after that, after it heals, you would get to see a general dentist and they would place a crown on that. The next question is, when the bone grafting be required for dental implant placement? Well, if you have insufficient bone to place the implant in, basically the implants are screw, right? So the screw has some kind of diameter to it. So when you have a bone that is very thin, then you cannot place the screw because the screw is going to be too big. It's going to be bigger than the bone that we have. So in those cases, you would need a bone graft to be placed. So it's kind of like the road when the road is too thin and you can't drive through it in your car, right? You want the expansion of the road. So that's what the surgeon will do. They will add the bone grafting material on the sides of it so you can have the implant placed and there's still bone on the sides other than the implant. The next question is, when choosing artificial teeth, what pros and cons that I have for each? Well, artificial teeth could be a removable denture. Like if you're missing all your teeth and you want to get a denture, it is the least expensive treatment, but it's also the least comfortable treatment because at the end of the day, you have to remove the dentures from your mouth, right? And of course, the function of a denture is not the same as your own personal teeth. So the next one would be the closest one to your natural teeth would be replacement by implants, because you treat them the same way you would treat your teeth. So you brush your teeth, you don't take your teeth out to brush them, and you don't take your teeth out to eat your food, right? So the same thing when you have implants, you don't have to take them out to clean them. You clean them inside your mouth just like you would do with your natural teeth. And when you were supposed to come and see hygienist regularly so you can get maintenance cleaning on it. But the usage of it is really easy and most comfortable with the dental implant replacements. There are other options that you have when you need only partial replacements. For example, if you're missing one tooth, you can get a 3-crown bridge, but it would also mean that you would have to get the other 2 teeth prepared for crowns. If you already need that because the teeth had root canals, fine, but it doesn't feel good to destroy two teeth to add one more. So the implant in that sense would be the best option because you can actually replace the tooth that is missing without touching adjacent teeth, right? The next question, how long does it typically take to recover from dental implant? Well, you're going to be a little sore that same day after anesthetic wears off, but most people don't need to take any medication for that. So it's not the kind of pain that you're dying from. It's just a slight discomfort and you should be okay right away. The next question, how long do dental implants last? Most of the time, the implants will last you for life. Of course, there's different data that says 10 to 12 years, and then you may get some issues, but most of it depends on your medical health and on your maintenance habits. Do you get your cleanings regularly? We recommend that you get your cleanings every 3 months if you got implants. So you see hygienist, and she would get you cleaned up, and you do that every 3 months. Of course, you're also supposed to brush and floss at home, right? And if you maintain it well, then they will last you a lifetime. The next question is, can dental implants get cavities? Well, implants are not really organic matter, so bacteria doesn't live in them and they don't oxidize. So the answer is no, you cannot get decay in dental implants. The next question is, what are the cost and the financial options on getting implants? So it depends on your financial situation. You can choose to either pay for it out of your pocket, and you can use checks, credit cards, cash if you prefer, or you can actually borrow the entire amount. We do work with different companies that can lend you money for the treatment that you need, and you would pay them slowly over a period of time. Depending on your credit score, it could be something that you use with low interest for a year or two, or if you prefer, you can actually get it for up to almost 10 years and pay them over a period of time. Yes, those plans are with interest, but if you make your payments the smallest because you borrowed it for a long time, you can finish your payment faster by paying more than what your required payment is, and you won't pay the whole interest then that way. The next question is, do most insurance companies cover the cost of dental implants? And the answer is no, they do not. Most insurances don't cover it. They actually classify it as cosmetic replacements, even though the tooth that you're missing may be in the back and it's not cosmetic, so it's not in the line of view, but insurance companies are very smart. So they classify the implants as cosmetic, and then they will not have to pay for them. Some insurance companies will make partial payments, but they would want to share the cost with you for it. And also the limit of the maximum that you can spend on from your insurance is not that high. Therefore, not everything would be covered by the insurance in full. The next question is, how can I schedule an appointment to talk to dentist about dental implants? Well, you can call us at 718-728-3314 and request a consultation with either me or my associate, and we'll get you all consulted on it. We'll explain everything that you would need to get your implants, give you different financial options, and then we'll make it easy for you to actually get the implants done. It's not going to be very painful and so on. Getting implants, it's nice and easy, and it's not as bad as getting extraction, for example. So, like I said, you can call us at 718-728-3314 and request an appointment for consultation, or you can request an appointment by going online, going on alldentalneeds.com and request a certain time and day that is convenient for you, and somebody from the office will call you and help you schedule that appointment. Well, that's all the questions we have for now about dental implants. So thank you very much. And I hope you do give us a call and schedule an appointment for the consultation about dental implants. One more time, the telephone number here is 718-728-3314, or you can go on alldentalneeds.com and request an appointment.